Hello, this is Dr. Lara Tigler. Welcome to my channel. This channel is meant to provide general medical information. It's not meant to provide specific medical advice. Please do see your primary care provider or your doctor to obtain medical advice that's tailored specifically for your needs. At the end of the medical information today, I will provide some spiritual information. If you do not want to stay for that portion of the video, once the medical information portion is finished, I will let you know, and at that point you can simply click away. But first, please do like and subscribe. Today, we're going to cover some updates on hypertension and chronic kidney disease. As many of my viewers know, I have already made a video series about hypertension, and I've already made a video series about chronic kidney disease. So if you need a refresher or to review the information, please go back to those videos. So I'm going to show you how to get into the most up-to-date guidelines for chronic kidney disease. The website, well, the guidelines I'm about to show you are copyright protected, so I'm not going to give a whole video or lecture on the entire presentation. I'm just going to show you how to get to that information and then show you a couple items. So go ahead and type in KDIGO. That should be all you need to type in. And then go ahead and click on the website. At the very top, you'll see that it says guidelines. Now they are going to come out with new guidelines. It'll be 2025, 2026. So that should come out any day. But right now, the most up-to-date guidelines for CKD, see how it says the letter C, K, and D? Evaluation and management. On the far right side over here in this big column, at the very top, it has 2024 CKD guidelines. So that's what you're going to open up. And you can go to this general website and look up specific information that you need to look up. It's open access to the public. Okay, now you can see the blue and green title there. I'm just going to scroll down. And now I'm going to magnify. So I wanted you to see a specific word. See how here it says Table 8, indications for use of cystatin C. So that's a relatively new blood test, and it's helpful to confirm whether or not the patient has chronic kidney disease. It is not needed for the confirmation of every single time we diagnose CKD, but it is a helpful blood test in certain specific situations. So it's good that you know that we have that. I better go there again and make it bigger for you. Okay, it's right here. CYSTATIN. I know that it has the word statin in it, and that's confusing. You might think it has something to do with cholesterol medication, the statins, but it doesn't. This is cystatin C, and it's specific for confirmation of chronic kidney disease. So let me make this a bit smaller again. There was another very important table I wanted to show you. This very colorful image here. Okay, so current chronic kidney disease nomenclature used by this organization. Nomenclature means language or how we present the information. So chronic kidney disease is defined as abnormalities of kidney structure or function present for a minimum of 3 months with implications for health. And I gave, as I said, information on several videos about the implications. Chronic kidney disease is classified based on cause, glomerular filtration rate, which we abbreviate GFR. In the exam room with the patient, we almost never use that mouthful of a phrase. In fact, for some reason, I'm a senior specialist, so for some reason my patients seem to be stuck on creatinine because years ago that was one of our main parameters for measuring kidney health. But nowadays, we typically always say GFR. And sometimes to make it even simpler for patients, I'll say how fast your kidneys are working, or the kidney rate, or the filter rate. And then if I use the word filter, I'll have to explain what a filter does. The blood presents itself to the kidneys. The kidneys are a very sophisticated filter. They filter the blood, and that's where your urine comes from. Because if you step back a second and think, where the heck does my urine come from? That's your blood, but it's your filtered blood. So it has only bad stuff that your body's kicking out, like ammonia. The body tries to keep in good stuff, like glucose and protein. So the kidneys filter. But you can see how time intensive this is, explaining this to patients. And I think it's important if you have chronic kidney disease or you have a family member who has it, that you do some research yourself. And then you want to go to trusted organizations and websites. So that's why I'm doing this video, to show you what many of us doctors in the United States are now looking towards, is the KDIGO or KDIGO guidelines. And so here is a really nice, colorful graph to show you. Now they use the letter G on the side here. I think that's misleading. It stands for glomerular, but the 1, 2, 3, 4, and 5, those are stages. So you have chronic kidney disease stage 1, 2, 3, 4, and 5. And you'll notice for 3, we do break it up into parts A and part B. So over here in this column that I'm highlighting right here, there's a lot of numbers. Normal at the top, if the person has damage to their kidneys, but their filter rate is normal, greater than or equal to 90, then they're the least, have the least damage to their kidneys. And all the way down, stage 5 is the most damage. And then this number here, the 15, it's not percentage. It's actually a rate, how fast the kidneys filter. But anyway, I very commonly calculate and figure out the stage of chronic kidney disease for patients. But I wanted to show you that on the right side here, we have 3 additional columns. And at the very top, you see A1, A2, A3, capital A1, capital A2, capital A3. And that's important because you're not going to get the full staging. It's not cancer, it's a disease, but we use the phrase staging. You're not going to get the full staging unless you provide a urine sample to your provider. And I've noticed that sometimes providers aren't as up to date on chronic kidney guidelines, or they might be missing the risk factors that you have and that you do need to be checked for chronic kidney disease. So it's important that you're knowledgeable about this, that not only do you want to give blood for your doctor, but you need to give urine. And if they're not ordering it, you might have to tell them what test to order. But depending on whether there is a certain type of protein in the urine, albumin, ALBUMIN, urea just means in the urine, that will give you your deeper staging for your chronic kidney disease. And you can see if it's A1, then there might be no protein in the urine at all, or it might be less than 30 milligrams per gram, or less than 3 milligram per millimole. Labs will present the unit in various ways. But you can see that if the kidney is filtering at a really good rate, and you don't have any protein coming, or much of any protein coming in your urine, that's a relative green zone. That's pretty darn mild. So that will help your primary care provider, like a senior specialist like me, if you're age 65 and older, or your nurse practitioner or physician assistant, that will help guide them as to what medications to give. And that's the last point that I'll give for these guidelines, because like I said, I can't teach you the whole thing, is that this particular pictogram here will help guide the physician or provider as to what medications that you will need. Lifestyle modifications are needed, but also certain medications. So here in the red, these patients, as I mentioned in prior videos, can benefit from the relatively newer medications that we have out, the SGLT and the GLPs. And I have made some videos on just those medications as well. S is in Sam, G is in go, SGL, L is in Larry, T is in Tom, SGLT. And the GLPs, I think most of you are familiar with those because they're in the news all the time. That's like the Ozempic type of medications. Okay, so I'm going to get out of this window. So I gave you some updates on the kidney guidelines. So now let's go to blood pressure. So the American Heart Association, I'm going to type it a bit different, and ACC goal blood pressure. Because remember when I talked about blood pressure in those videos, I don't know if you remember looking at and listening to all those videos and remembering that there were so many different cutoffs for what's normal, what's not, when to treat, when not to treat. So we have many, many different guidelines out there, and we're getting smarter at blood pressure too. So the chronic kidney disease guidelines we're zeroing in on what's important. We're getting more and more information. And to be honest, it's only in the past decade or so that we've had such good medications that it makes a difference how we diagnose and categorize and stage the chronic kidney disease, because now we have really good medications and we can make a difference in your life. We can prevent dialysis now. So that's a big, big deal. And although the blood pressure, hypertension field maybe isn't as advancing quite as much as the chronic kidney disease area or even the heart failure area, our evaluation and treatment of blood pressure is also advancing. So if we primary care physicians, and like I said, I'm really more of a senior specialist, if we apply all of the guidelines that we're knowledgeable about, we can save 440,000 patient lives per year just from giving guideline-directed advice on lifestyle changes and tweaking perhaps medications a bit. So these guidelines do matter, and this could save your life or your loved one's life. So I wanted to point out the 2025 AHA-ACC guidelines. That's the American Heart Association and the American College of Cardiology. I myself, my professional society is AAFP, American Academy of Family Physicians, and I'm up to date with my review in that area, and we are beginning to fall in line. All of the professional societies haven't fallen in line yet, but we're getting there. So now look at this number, 130/80. For adults, the blood pressure when you're at rest should be less than 130/80. Okay. And as I explained in prior videos, really the best is less than 120/80. But this is the goal that we're reaching for all adults. When you come to the doctor and we check your blood pressure, we expect, if everything's done correctly, you're sitting in a chair with the correct position. Ideally, you've emptied your bladder prior because that'll help keep the blood pressure lower. Your arm is at the level of your heart, not lower. There are many things that need to happen to make your blood pressure accurate. And so if we get an accurate blood pressure, then the normal blood pressure should be less than 130/80. All right, so that's a very important update. So please type that in and see down here, target goal, the overarching treatment goal is less than 130/80. Normal is actually less than 120/80, as I said. Elevated is between 120 and 129 for the top number, or the systolic. Stage 1 hypertension. Now, just to let you know, we don't often talk in stages when we talk with patients. Honestly, it's enough just to get patients used to the idea that they have a condition, because as you can imagine, it's just so common for patients to say, well, I just came from busy traffic, and that's why my blood pressure is high, or I just had an argument with an insurance representative on the phone. There's a lot of excuses and reasons. Or the person had a lot more caffeine than they usually have, or they drank alcohol the night before and they never usually do that, or they were smoking quite a bit more than their usual, or just smoking within 30 to 60 minutes before the blood pressure. So there are many factors. But as I said, if you're waiting at least 5 minutes seated in a calm, quiet condition, your blood pressure should go down to its baseline. Okay, and then so there are stages for hypertension. Stage 1, and believe it or not, the top number being between 130 and 139 is stage 1. If you have a blood pressure that's elevated in just one circumstance, but all your other blood pressure readings are normal, of course, you're not diagnosed with hypertension. So anyway, that was one of the things I wanted to show you. And then I'm going to go ahead and stop sharing and show you 4 different abbreviations. Sorry about all these abbreviations, but I wrote these notes so that, partly I can remember to tell you what you need to know. And so we already covered the American Heart Association, and we already covered the American College of Cardiology and the KDIGO or KDIGO. But over here, I wanted to point out, currently, when you see the physician, you're getting an office blood pressure monitoring, and that does need to be done correctly. We want to make sure it's done correctly so we don't overdiagnose the condition or underdiagnose the condition. And then the H here stands for home. So home blood pressure monitoring. So by the way, if you have an elevated blood pressure or hypertension problem and you are checking your blood pressure at home, if you have a good machine and you're always in a proper ergonomic position, in a quiet room with some of the caveats that I mentioned earlier, your home blood pressure monitoring log could be rising to the level of the gold standard. So just make sure that you're doing everything right. If you are, I do recommend checking your blood pressure on a regular basis, writing on a piece of paper with the date, and please provide that paper log ideally, because doctors' offices cannot interface with all of the various consumer wearable devices and programs and softwares. So providing a paper log is very important, and then the doctor office can scan that into your chart. But if you're doing it correctly, your home blood pressure monitoring might be sufficient. However, and I'm going to jump down to the bottom. See this circle? We're going to do that last. Okay, so ambulatory blood pressure monitoring, that is currently the gold standard, but that is a costly device, and many people don't have sufficient insurance coverage to allow that device to be ordered by the physician. So that is the traditional gold standard. If you can get an ambulatory blood pressure monitoring machine to check your blood pressure when you're at home or in your day-to-day life, it provides readings of your blood pressure to your doctor's office, and averaging all of that out, that can give a truly accurate blood pressure reading. But as I said, it's just so rare as it's practically not done, as at least not in the primary care setting, in the cardiology setting, specifically hypertension clinics might have the resources to give that to patients. But now there's a new kid in town, automated office blood pressure. A stands for automated office blood pressure. So we can, primary care offices like myself, now my current primary care office does not have this device. We don't have this capability yet, but this is approaching the new gold standard. So if your doctor's office can provide an automated blood pressure, not the one they're currently doing that's on that stand-up moving tray. This is a specific, different new device. If they have that device, what they'll have you do is they'll have you sit in the room in the proper position, and then you'll be sitting quietly by yourself for 3 minutes before this automated machine will even start. So it'll be 3 minutes that you'll sit down. The medical assistant will leave the room, and then that blood pressure cuff on your arm connected to this specific type of device that's high standard of accuracy will start checking your blood pressure. And then it'll check your blood pressure. It'll wait 30 seconds. It'll check your blood pressure again. It'll wait 30 seconds, and then it will check your blood pressure again. So only with this automated office blood pressure specific machine can you check your blood pressure on the same arm 30 seconds apart. This has been well studied for this particular method. And then what the machine will do is average the three blood pressures, and it'll give the doctor the correct blood pressure. Turns out this method is the best. But as I said, not even my office has this method yet, and we're a very high standard office. But that is going to be coming. Okay, so now I'm going to show you the spiritual information. So this is the end of the medical information. As I said previously, if you do not want to stay for the spiritual information, this is the time to click away. But first, please do like and subscribe. Okay, so today for the spiritual information, this is Holy Week. I don't have anything to add. This is Holy Week for Christians. I don't have anything to add on the Holy Week. I mean, it just is, I'm speechless. So I'm going to just go ahead and read a small excerpt from my fiction book. And remember, the hero in that book is a woman of faith. So if you are a Christian or really any faith or no faith at all, this book is very entertainingly written. If I do say so myself, I'm sorry to toot my own horn, but I do think it's well written and the editing is tight. So I think you'll enjoy it. But I thought I'll just go ahead and show you the cover, An Impossible Situation, Oppenheimer in Time. I promise you, I did start writing this book before the movie came out, for sure. And this book was published well before AI came out with sufficient ability. So I wrote the book, edited the book. Of course, I had an editor as well. But this is, I think, a good book to read, say at bedtime. It is adult content, so it's really only for adults. But it's entertaining. Maybe if you're on a vacation, it's meant to entertain. But interestingly, it does intertwine Hinduism and Christianity. And how many books do that? How many fiction books do that? So I think it's interesting to see this woman of faith, how she has to navigate a mystery thriller story in the context of a spiritual path. And then the putting together two different cultures, not even religion. So yeah, I hope you enjoy it. Okay, so I was just going to start at page 190. I just chose a spot. So my name is Lara, but the woman of faith, her name is Lara as well. Okay, so Lara found the journey through time difficult. She was being pulled and pushed all at the same time. No one dared let go of their grasp on the other. The heaviness and drag seemed to be carried mostly by Lara, but she did not let go of her focus. As difficult as it was for her, at least in comparison to her previous time journeys, she could sense that the others were having it even worse. Even in that moment, her ability to empathize with others was still strong. She recalled that it takes a while to get used to time travel. Probably the others were nauseous and weakened from the dragging sensation. The peaceful in-between place came into view. It was just as Lara had remembered it, only more beautiful. As the others were getting their bearings, Lara was bracing to meet the devil, because she had met him there before. But she looked around and saw no one else. Relieved, she made sure to start separating herself from Pavin and leading Sujata and her dad away from the bad guys. She had no plan, but she knew that she needed to distance herself from them. It was the agent who recovered first. So, Kunal was right. Time travel really is possible. He was well pleased. He knew about the doors, and he knew about the access he might have to other times and places. Unlike Sujita, and I'm not making a mistake here, Sujita is Sujata's sister. Unlike Sujita, Lara was more of a fighter. She may not have had the same level of faith as Sujita, but she had grit. She pulled a knife out of her ankle holster. Don't come near us. I know how to use this thing. She could see that Pavin was bracing for a fight. The assassin lady, too, was recovering from her nausea. Just as Lara was wondering how in the world she could fight them both off, she heard a heavenly voice. They all heard it. That door. India. Was Lara imagining it? Or did that voice sound an awful lot like Sujita's? It was almost like the time that she heard the word Virginia. But it wasn't Sujita's voice. It was something more. Lara did not need another moment to obey the godly command. She pulled Sujata toward herself and said, I know this is hard to believe, but you have got to go back home. What? Why? Where? Poor Sujata, thought Lara. No time to explain. Sujita will show you the way. It is time to have faith, Sujata. You must be brave. And as Lara said that, she pushed Sujata and her father through the nearby door. But as she did so, the assassin lady grabbed onto her. As they were fighting, the agent guffawed. I know what we shall do, Lara. Let's fix this situation before it even has a chance to start. And as Lara pushed off the assassin lady, he dragged her away from Lara and pushed her in front of another door. What are you doing? Are you mad? And Lara knew that the assassin lady was right. The agent really was mad. He was out of his mind with the lust for ultimate power. You see, the assassin lady and the agent are in cahoots. Kill Lara. You will find her on the beach. It is all her fault that Kunal is gone. She must pay. And as he said that, he sent the assassin lady through another door, keeping in mind that the Lara he was talking about was the Lara in the past, at least from Lara's point of view. Somehow Lara knew that the assassin lady was sent back to that same beach in the Caribbean where they had first met, and she could see now why the assassin lady was so angry. She blamed Lara for everything that was going badly for her and the bad guy team. The assassin lady had no choice but to obey this new devil in charge. As the agent was gloating and clearly reveling in his newfound role of taking charge of time, Lara was left to battle Pavan. Don't do this, Pavan. You're better than this, Lara said, but at the same time, she was bracing for a fight. Don't do what? You don't know me. He was circling Lara. He realized that she was more powerful than expected. He was not sure how to get out of here, but he knew that Lara and maybe the agent did know a way. He was hedging his bets. I know that you got it. I know that you got in with the wrong crowd. You made mistakes, but it wasn't your fault that Sujita left. Pavan was surprised. He put it all together, and in a flash, he realized that Lara was speaking the truth. She was a mystic traveler. He knew that now, and he also knew that Lara and his sister must have been friends. See, Lara was friends with Sujita. Lara could see that Pavan was thinking. She knew it was now or never. When she looked around, she could see that one door seemed brighter than the others. She knew that was her ticket. She ran at top speed for the door. Bum, bum, bum. So if you want to see what happened, you have to go to Amazon and buy this book. Remember, my name is Lara Tigler. Okay, everybody, it's been such a pleasure. Enjoy and see you next time.